Hi, YouTube family. I wanted to do the conclusion of this video today because it's short and I didn't want to wait to do it at another time. So this will be the conclusion of my breast cancer journey. And one of the things I want to say here is that uh, it's your story. When you share with people, when you feel comfortable, when you feel that you're ready, you don't owe anybody anything. So when you feel that you're ready to share your story, then you should share your story. Don't feel that you have to share it if you're not ready to. And also, I want to talk about genetic testing. I had genetic testing done uh, for my daughters and for my family to see if there was any mutating genes or something that wasn't right in our genetics, and that came out fine. And also, with my daughters, I let them know because they need to have a mammogram or an ultrasound done. Now, Maya was too young to have a mammogram because they usually start at 40 doing mammograms because they don't want to start younger because they don't want all that radiation in your system for that length of time. But it always gets me. It's like the you don't want us to have radiation because it could cause cancer, but you're saying the same thing that causes cancer can help cure cancer. You know what I mean? So they didn't want to do Maya to have a mammogram, but she had an ultrasound. So they went and they talked with their physicians. She had an ultrasound. Nikki, however, they would do a mammogram. She was older, so they did a mammogram for her. So it's good to let your family know, especially your immediate family, know about your condition whenever you're ready. And also, I wanted to stress that sometimes during your cancer treatment change or the information don't get relayed to you. Like when I first started out, my the cancer I had was they said it was a stage 1 and it hadn't metastasized, and the MRI didn't show that it had spread. So they said it was a stage 1. But later on, I was reading some stuff. And I was saying to myself, it spread to my lymph nodes, so it can't still be a stage 1 from what I read. So when I went in to see the doctor, I said I was told that it was a stage 1, but I think according to what I've read, it's a stage 2. So she checked it and she validated that it was a stage 2. So you got to stay up on your treatment because not everything gets relayed. Um, there's so many things going on. I don't know. You just got to stay in touch with your doctor and with your treatment and stay on it, um, and stuff like that. I also had a bone density test done because bone density would measure to see if you're losing any calcium in your bones or if anything's happening with your bones. So I've had a couple of them, and I had one the other day, and my levels are still the same, even though I'm on tamoxifen, which can cause you to lose bone. I'm on that medicine, so it hasn't affected me in that way. It hasn't affected me negatively in that way, that we know of. And again, I want to stress the importance of even recording your conversations with the doctor because when you're diagnosed with a disease, your mind, you're so consumed with maybe having that disease that you can't take in everything that they're telling you at these appointments, and you're seeing a few different doctors. So I think it's a good idea if you can record those conversations so that you can hear them. And also, I think it makes them more accountable. I told them before I taped them and they were fine with it, but I think it makes them more accountable. Not that they would tell you wrong things, but they know that they're being recorded. And I think that's a help for you. Um, and I think that's it. And follow up, you're going to see, I see my cancer doctor, the chemo doctor, more than I see anyone else. I see the surgeon every 6 months. Then it goes out to a year. I see the radiation doctor. I think we spread it mine out over a year because when you're first diagnosed, after your diagnosis, they want you to see somebody every 6 months. So whether it's the chemo doctor or radiation or whatever, but when they're scheduled close, like my radiation doctor say, do you mind if we put this out because you're going to see this doctor that month anyway. So, and that was fine with me. But they want to follow up. I guess cancer have a greater chance of returning within those first few years, so they want to keep check on you more often. And I started having my um, I had I ended radiation. I had 16 rounds. In the last video, I said six for some reason. I had 16 rounds of radiation, and my breast was really swollen. So I had to space out my mammogram to a time where the lymphedema would be down. It wouldn't be a good time to have the mammogram when your breast was really swollen. So I had my first mammogram in August after I'd finished my radiation. I think I finished my radiation in March, I think. So I had that, and I followed up with them uh, every 6 months for a couple of times, and now I'm back out to having a mammogram every year. So they'll follow up, but they still see you, and I'll see my surgeon in January of next year. So they follow up with you to make sure that you're doing okay and to see if you need anything, if they have any suggestions or whatever. So just stay involved in your treatment. You have any questions? There's all kind of material that you can use. You can ask your doctors. I mean, the nurses are helpful. Just follow up and be kind to yourself. Treat yourself nice. Be kind to yourself. Be kind to your family, and be thankful. I'm thankful every day. Um, and that's it. That's all I can think of. Thank you guys for listening. Bye bye.